Dr. Boss, some of your patients have been getting notifications about programs like ChartSpan. Can you tell us why you're adding some of these new services and why ChartSpan might be helpful to some of your patients?
Sure. So ChartSpan is chronic care management. A lot of our long-term patients will know we've been doing chronic care management for years now. We were one of the first practices to start doing chronic care management. What it is an idea of giving extra service for our patients. What it comprises of is a nurse, an RN, who is calling our patients that have at least several medical problems. And the whole idea is to keep them out of the hospital and healthier. So what the nurse does, and we've already been doing this on our own, is calling our patients that are higher risk for problems, call to check on them, and it's an available resource for the patient. So the patient gets the nurse's phone number, she can contact her directly. The nurse is calling to check on that patient, as often as needed, but at least a couple times a month. And then if there's any problems identified, the nurse has a direct line to the doctors and nurse practitioners in the office to make sure that the patient gets whatever they need. It could be an appointment, right away. It could be services sent out to the house, etc. So we've been doing that on our own for a few years, and that mostly on our sicker patients, our most, patients that are highest risk. So, but we've now partnered with a company called ChartSpan, who also does this for us. This is a great resource for all of our Medicare-age patients. It's a remote nurse who calls to check on the patients, but the patient gets that nurse's cell phone, or at least that service's cell phone, and they have 24/7 access to a nurse. So if you have any problems, you could call them. And they have access to our office where the same deal. If the patient's having an issue, they can get that patient in the next day, contact our office if any services are needed, etc. So the whole idea is to keep you out of the hospital and to keep you healthier.
Sounds great. And if a patient wants to participate, how would they do so when visiting the office?
Patients have been getting notifications from ChartSpan and from our office about this. It's a very simple matter of just checking yes and signing up, and someone contacts the patient and gets all the information. And then once they're enrolled, they'll start getting regular contacts from these nurses.
Sounds great. Thanks for the information, Dr. Boss.